Dwayne, that was fabulous. Thank you. The last but not least, Eileen Den is going to talk about support for patients and family. Eileen is our nurse coordinator on the melanoma program. She came to us from a long period when she was up on the oncology floors. You can't help take care of patients without a great team, and I don't think it's possible to understand how difficult it is to coordinate all the aspects of what we need to do in order to get things done. And without Eileen, I don't think we could deliver this kind of care. She's going to speak primarily about support for patients and family, but she has a much bigger role within our program. Eileen, please.
Well, as Dwayne said, for many cancer patients and their families, the experience of cancer is an intensely stressful one. And emotional support is important for most during both their treatment and also afterwards. And it can be gained from different people and services. Oops, okay.
Let's just go here.
Okay, and then if I click, it'll change? Yeah. Okay, there we go. So I have the distinct honor and pleasure of being the oncology nurse coordinator for the melanoma and renal team. This was a position that was newly created with the opening of SMILO, with the idea that every disease team would have a designated nurse serving in that position. We are to be the primary contact or the point person for patients when they first enter our system. And our role is basically to sort of navigate you through the very complicated and confusing healthcare process that we have here at SMILO. Trying to get you from point A to point B sometimes can be very challenging, and that is one of the roles that I serve on a daily basis. We also are very fortunate to have a dedicated and committed social worker that is available to us during the clinic, as well as by phone. Her name is Jan Lankowski-Mueller, and if her daughter wasn't getting married tomorrow night, I was going to make her do this talk. So Jan is the co-facilitator with me for the support group. She also likes to have her focus really be on teaching coping skills, and as Dwayne mentioned, for patients and their families to maintain resilience through this time, and is a very valuable source of resources and information to try to help people with needs that they might have out in the community as well. So at SMILO, we are fortunate to have dedicated support groups for every one of our disease teams, including this year we have a new caregiver support group, as well as a support group for young adults with cancer as well. The history behind support groups is from in the 1970s, if you remember that there were meetings called encounter groups for therapy, and became very popular. And then there was a very influential study done by Dr. David Spiegel from Stanford University in 1989 that started out with women with breast cancer. He also repeated this study in 2007, and basically the results were the same, that it reported that people that participated in support groups had a better quality of life. Support groups can present information, they can provide comfort, teach coping skills, help reduce anxiety, and provide a place for people to share common concerns and emotional support. In the last few decades, research has further shown that giving patients information in a support group setting can help reduce tension, anxiety, fatigue, and may lower their risk of depression. People who take part in support groups believe that they can live healthier and happier lives, and they often say that when they have emotional support, it is easier to deal with their health and social problems. And some people claim that the bonds that are formed at a support group actually helps them feel stronger. And I know that for some of our members of our support group that have been with us for a very, very long time, they may not always attend the meetings anymore because they are survivors, but they stay in touch with one another through emails, and when they have good news on scans, they share it amongst themselves, and I'm CC'd on the email, so I get to take part in that good news. And these relationships were truly formed from meeting one another at our melanoma support group. So I just wanted to briefly tell you some of the programs that we have here at Yale. For some of you in your folders, there was a booklet that has all of the programs listed. If you did not get one and would like one, we can probably make arrangements for that. I thought I had brought enough, but unfortunately did not. But one of the programs that we have here is the Parenting at Challenging Time. This is very helpful for patients who have young children or even teenage children and are faced with how to tell the kids, what to tell the kids, how much to tell the kids, what resources are available to them outside of Smilo, how to deal with their school, and various programs like that. We also have a wonderful patient and family resource center that is located here on the first floor of Smilo. And next time you are here, if you ever have the opportunity to go in, it is staffed on a daily basis. They have computers that they can help you do research with if you want to do a search on anything. They also have a lot of books and journals and articles, and many times they also have cassettes and audios that if you wanted to take them, you can actually, I think they give them to you for free to listen for relaxation techniques. They have many CDs that they lend out, and it's an opportunity for you to stop in and just see what might be helpful or useful to you. And last, we have our Survivorship Clinic, and we are the first to have a dedicated multidisciplinary resource for adult cancer survivors in the state of Connecticut at Yale. And it is to provide patients and families with vital information on cancer prevention, wellness, support services, and the latest health research related to cancer survivorship. And although I wanted to have the slide of Sgt. Pepper's Lonely Hearts Club Band and have you all sing, I get a little help with my friends. My husband told me that was not professional. So I just want you all to know that you are not alone. I am in clinic every day, as is Jan, and also I would like to also mention that we have a wonderful practice nurse, Destiny, who many of you probably see more than you see me. I'm behind the scenes. She's actually in the whole flow of it, and we also have a wonderful nurse practitioner, Matthew Burke. So thank you very much.